the Erie Wellness Podcast, your go-to source for all things health, wellness, and living your best life right here in Erie. I'm your host, Lauren Brunetti, and I'm so excited to have you here. Each episode will dive into conversations with local experts and wellness professionals who are making an impact in the world of health and well-being. Before we jump in, be sure to like, share, and comment on this episode. We love hearing from you and seeing our community grow. Now let's get started. Welcome to the Erie Wellness Podcast. Today we're sitting down with an incredible husband and wife chiropractic team, Dr. Brynn and Dr. Zach, who are redefining whole family wellness right here in Erie. Dr. Brynn specializes in pediatric, pregnancy, and family chiropractic care, helping moms, babies, and growing families thrive with her gentle, holistic treatments. As a BirthFit Leader, she's passionate about supporting women through every stage of motherhood, from fertility and pregnancy to postpartum recovery and beyond. Dr. Zach, he brings his expertise in sports chiropractic, working with athletes of all levels to optimize movement, prevent injuries, and enhance performance. As a Titleist Performance Institute certified provider, he has a special focus on golfers, helping them improve mechanics both on and off the course. Together, they're on a mission to help our community move better, feel better, and live healthier. Let's dive into today's discussion. Welcome, Dr. Brynn and Dr. Zach.
Thanks.
Thank you very much. We're happy to be here.
Can you guys share what initially drew you to chiropractic care and what inspired you to pursue this path?
Yeah, do you want to start?
Go ahead.
So realistically, chiropractic care was not on my radar till I really got to like the end of my undergrad season. I was thinking PT for the longest time. And then I went and like shadowed a chiropractor, and that was like outside of a pool clinic that I was working on. And it really just hit. It was something that made sense. It was kind of PT and chiropractic put all together. I just kind of fell into place, and it felt right too. So went like looking for schools, and that's how I ended up at Palmer, which is in Davenport, Iowa. And that's kind of how my journey started. I had never been chiropractic. I've never been adjusted before I honestly went to chiropractic school, which is kind of unheard of, not really a thing. So it was fun to be a little different and get to experience it firsthand when I actually got to school for it. So
that's awesome. So you knew you wanted to be in like health sciences essentially, but you didn't know exactly where you wanted to land.
Yeah, I was definitely going to be the epitome. Like I was the kid that wanted to be the veterinarian for sure. I was like taking care of my stuffed animals. So I knew always healthcare. I just didn't really know which side of healthcare, I guess you could say. But it came together. It worked out.
And Dr. Zach, what about you?
So my mom's a nurse practitioner. She was even a nurse before that for, I want to say, close to 15 to 20 years. And has just worked really hard in that field. And it's that initial draw, like Brynn said, to help people, really why anyone gets into any job for the most part. But in healthcare, it feels a little bit extra special in that regard when you're helping people get out of pain, helping them improve their lives and do all those sort of things. So that's really nice. But the initial draw was my mom being in healthcare, and then I had received great care from chiropractors growing up as a kid. So I thought, this could be something that makes sense. And then the final straw was just sitting in our union in undergrad with a buddy after a biology class, and he said he was going into it. So I just started to look more into it, visited schools, and just kind of same as Brynn, just made the jump.
Mm-hmm.
So growing up, did you get monthly adjustments? What was your kind of routine as a kid?
I feel like I was kind of somewhat of like almost what we see in our office. Like I was a little bit more of like whenever it hurt, I'd say, Mom, like, will you walk on my back? And then she'd say, no, I'm going to schedule you a visit with Dr. Bolin in our town. So I just would go in. He would do his thing with me, certainly not monthly or anything. It just seemed to be, as I grew up in sports, as things seemed to bother me. Would just go get seen by him maybe a couple times for an issue, and then whenever I would need it again.
I take my kids, especially if they're like starting to be sick or something like that. That's another one where I'm like, okay, let's go get an adjustment.
Yeah, totally.
Absolutely.
It's helpful on that end too. It's kind of cool. Chiropractic can kind of be what you need it to be. I think that's kind of the beauty of it. And what I think drew us to chiropractic itself, speaking for you.
Yeah, and even my mom, going back to my mom too, she told me, she was like, I was thinking physical therapy route. I think there's a strong commonality with chiropractors and PTs in terms of maybe thinking of doing either one at a given time. And my mom just, kind of thought scope of practice with chiropractic was a little bit more interesting, had a little bit more opportunity with it. We don't need referrals or anything like that. So you can just come into our office for whatever concern you have. You're able to just go from there rather than having the referral from MD or DO. Not saying that that's a bad thing at all, but just in terms of being able to operate a business, a little bit more appealing.
Yeah.
Right. And waiting on insurance to approve things
Yep.
and all of that just slows it down.
Big time.
Absolutely.
Big time.
Definitely.
So like I was saying before we started recording, I was like, I'm so excited to have you guys on the podcast. I just feel like you're a power couple here in Erie and it's so fun. But what led you to work together as a husband and wife team? Did you both go to school together? Is that where you met each other?
Yep. First day. The class sizes are pretty small at chiropractic school. So we started off with 120, I think, in our class. You usually lose around 30 to 40 people. So we ended up graduating with 80 something, I think.
Mm-hmm.
But no, you get to know each other very quickly. You're in every class together. I kind of think like high school. You have 5 classes a day. You're going through it from 8 a.m. to 3 p.m. And then you've got labs with certain people afterwards. And then that changes every trimester because it's a trimester schedule. So you go to school for 3 1/3 year round, really no breaks. And you really get to see who you can work with and who you can't work with realistically too. But it turned out pretty well for us. We met and then just kind of stuck together through school. And then we interned with a couple docs. They're Doctors Alt. They're out in Hudson, Ohio.
Mm-hmm.
I had met them through my work with the alumni department at Palmer. And they were amazing. We were kind of fingers crossed hoping that they would hire us because they had a second location that they needed some chiropractors for. And we were like, ooh, this is a perfect time to get into this. And they were helping us if we ever wanted to start our own business. And they sat us down one night. We had a pizza night with them. And they went, we would love to hire you guys, but we're not going to. And I remember sitting there my heart dropped. I was like, no, this is a job.
You're like, I thought we had it all planned out.
Yes, I was like, we're graduating soon. I need a job. And they're like, you're going to go open up your own. You're going to be great. We're going to send you with all of our tables and stuff because they were redoing their place at the time. And so they gave us they gifted us tables, chairs, a bunch of supplies. We threw it all in a pod and we moved out to Colorado. And that's kind of the pipeline. It was we graduated October 2019 and we moved out here November 2019. And then the pandemic hit. But yeah, so that's kind of how we ended up, at least in Colorado. We really looked at a bunch of different places too. And this place felt like the right choice, really.
And when did you open?
We officially opened August 2020. We had every purpose to open March 2020, but the world had other plans.
Right. And just, 6 months of getting acclimated to a new place and starting a business, it probably felt really quick in the midst of a pandemic.
1,000%.
Yeah, absolutely.
We had second jobs at the same time too. He actually worked at UPS, kind of the graveyard shift. And then at the time I was working front desk at the Erie Community Center. And so that was a lot too, kind of moving those things around. That was a whole moving piece with the pandemic as well. But it really helped kind of establish people in the community with us. I got to meet a lot of people in the Erie community itself, coming in and out of that gym all the time.
Mm-hmm.
We actually got a really good ecosystem at UPS that still talk to some of those people. And that really kind of helped start to slowly dip our toes. And then we started meeting other people, kind of grassroots meeting at coffee shops and whatnot when we could. We still play by COVID rules for sure. But that's really kind of what got the ball rolling in a town where we really knew no one at all and had no family here or anything. So
that's so cool. Did you come to Colorado just because you enjoyed the outdoors and outdoor lifestyle?
Yeah, I'd say so.
Yeah.
That was the biggest push to come out here probably, or one of.
Yeah, absolutely. I would say we had a bunch of different states written down on a piece of paper, and Colorado made the most sense from a locational standpoint, things to do, entertainment, and just what kind of felt like it was scratching our itch from things to do standpoint. Mm-hmm. I want to just touch on the husband and wife aspect real quick too. I think that it's really interesting, and everyone assumes that we probably want to just not spend any time together at the end of the day sort of thing. And we did learn that from doctors Rebecca and Robert too. They framed it as they can't imagine working, they would sometimes work in separate offices and they hated it. They really learned to really enjoy working with one another. And I always, thought that for us. And I think that's the case on most days, right? It's like any situation, any couple, certain days aren't going to be as awesome as others. And then you do have to go home with the same person that you were technically at work with all day. But it's also nice because I feel like we've established our own practices within Wurth Chiropractic. Brynn really has her patient base and I have mine. We refer back and forth all the time, but it's nice to be able to, really give to others for most of the day. And then you get to see the other one kind of sparingly throughout the day and then, have lunch and then do those sort of things. So working together as a team has been really, I think, fun for us. Totally. And it's made us, like you were even saying, more dynamic in that regard too, being able to reach more people and then just even let our personality show and be ourselves has really been one of the biggest assets to our business too. So
totally. I get a whole another brain for my patients. They get 2 doctors instead of just 1. So I think that's super invaluable too.
Especially because, we'll talk about this, like what your specialties are a little bit more in depth, but you primarily working with a lot of women and that are probably raising kids and potentially athletes and all of those kinds of things. And then him working specifically with athletes and helping the youth with some of their needs and whatnot. So it's kind of nice to have that like referral back and forth.
For sure.
And we definitely know we fit the very traditional hats in that regard too, in terms of, the
it's a bit of a gender
populations
role.
that we see, but it does make it nice too. And like I said, we refer back and forth all the time. So it's kind of nice being able sometimes for me to see a pregnant mom, because then I get the chance, okay, clinically, let's go back to the things that use your education. And you can still help this person, maybe if you don't have the same exact knowledge or skill set as the person who would be maybe quote unquote more specified to treat the person too. So always fun and unique each day.
Totally.
Mm-hmm.
Absolutely. So let's get down to let's talk about the fundamentals of chiropractic care. So musculoskeletal care is a big part of chiropractic work. What are some of the most common cases or conditions you see day to day in your practice, and how do you approach treating them?
Absolutely. So yeah, musculoskeletal care is really the core of what we do. And breaking down that really hard to say word, musculo being, the muscle system that makes up your body that helps you move and do different things. And then the skeletal system, the bones, the joints that allow you to move, form structure to given areas as well. That's what we really look to treat each day. When people think of chiropractic care, right, they think of back pain, neck pain, all those sort of things. And that's a good bit of what we see each day. We're seeing things like postural strains, a lot of athletic injuries. And we say that, all of us are athletes. It's not just someone playing a specific sport. A given example, someone moving their furniture a given day, and then 2 days later, their back still hurts. They want to come in and see us. We'll call that an athletic injury because that's kind of what you were dealing with. But plenty of different situations, movement dysfunction just in general too, I think is a big aspect of what we see on the day to day, and just trying to help people, feel better, move better, be healthier is kind of, again, the overarching goal each time that we see them. But yeah, runners with knee pain, golfers with mobility issues, pregnant moms experiencing, back pain for the first time, pelvic pain. Those are definitely those most common cases that we're seeing day to day, and then viewing it from the more functional side of things too, and meeting them where they're at. And ultimately, kind of what we want to get into is the biopsychosocial model of care too, and recognizing that, when patients and practitioners, say they want to get to the root cause of an issue, we think that's through the biopsychosocial model, really taking a look at the biological aspect of things, the psychological components, as well as the social components to anyone's given life as well. We're talking about things like stress, sleep environments, nutrition, all those sort of things. So we're not just going to ask, hey, where does it hurt? What is it out of 10? Okay, get on the table, let's adjust you, right? We want to look at the whole picture, make sure that we're not just viewing this only as a structural sort of thing, and just kind of viewing it from a whole picture sort of standpoint.
How are some ways that you approach your patients to consider their environment, their lifestyle, and habits when working towards, achieving optimal health?
I think understanding their goals too, okay, this person's sitting in front of us right now, what's their given situation, and how does their day-to-day life look? If they're, a runner, how can we formulate their sort of day-to-day with different exercises, habits that can really help out in that regard? I think the most important thing is just trying to understand the overall ecosystem of anyone's given life. How can we kind of fit into different ways here, impacts you not only in office, but kind of outside of here too. Looking at the rehab side of things, that's what we view as when I talk about services with patients, we offer adjustments, soft tissue work, and rehab. The rehab side of things, exercises at home, is what we kind of view as the most important aspect of care. There was a recent New York Times article that came out that shows for the most part, that most research supports that exercise is one of the most beneficial things for back pain. So it's absolutely something that we want to try and implement in anyone's given day to day. It doesn't mean you have to go to a gym for 60 minutes a day and lift heavy weight. It could just mean implementing a little bit more day-to-day exercise, being cognizant of hydration levels and things like that too. So back to kind of the whole picture side of things, again, always establishing daily movement patterns that make the patient feel empowered and just feel better about their pain and movement as well. Super important.
I want to add one thing to that too. I think a big thing in healthcare is a patient's motivation. And a lot of times a patient's motivation can be, I want to be able to pick up my grandkid. I want to be able to squat down and pick up something else. I want to be able to, live a healthy life, be able to be pain-free in a workout, things like that. And we find that if that patient is highly motivated, or at least thinking about the motivation, we can feed on that a little bit. Then that gives us a window to really be able to dive in with the patient, show them that there's options and answers that we can give them. And if it's not necessarily an option or answer in our office, we're going to get them where they need to go. So I think that plays a big part into that biopsychosocial model that Zach was talking about. Kind of putting the control in their lap a little bit more. And when people feel more control and motivated in their healthcare, then they want to be an active participant in it. And that makes our jobs way easier then.
And it leads to higher outcomes. That's a really good point too. Absolutely.
Long term, people aren't just helping you come into the office and you'll do a quick adjustment and then they're out the door again. They really see the benefits of those little things you can be doing throughout your day and taking your exercises seriously or your recommendations seriously.
Yeah, totally. Absolutely. Longevity is what this is about. Like, chiropractic can be totally a Band-Aid for some people. Like I had an athlete in today and we're just helping him kind of stay up. He's a swimmer and we're helping him getting ready for the next big comp coming up. And I love doing that. I have some people that are like, can you just make sure my back feels good so I can get on this airplane tomorrow? Like, really, there is a short-term acute moment with it, but I think there's an overarching long-term piece that sometimes gets lost in chiropractic. And we want to make sure that is we set a bigger tone on that, I guess, lack of better terms there, but.
So when you're starting to get to know a patient, how do you build that trust and that long-term relationship so that they feel connected and you also make them feel heard and supported?
On the more business side of things, we offer very long treatment times. Our new patient exam's an hour. We are not going to be quick or rushed on anything. We think that first 20 minutes is so valuable in terms of getting to know the person, understanding their past history, that side of things. But then, more importantly, understanding who they are. Again, what do you do for work? What does your day-to-day look like? Again, and understanding your why. Why are you in here and what is going to be the ultimate thing that motivates you and pushes you to feel better, I think is a really important aspect. One of my favorite things was I had, again, a patient, and we'll go back and forth on this, but I had a patient in today. She became a grandmother last month. And so to ask her, how does it feel to be a grandma is one of the, I get goosebumps almost, because to me, it's one of the coolest things. It's why we do what we do. Point blank, the patients, if they weren't here, we wouldn't be here, obviously, but just getting to know them and who they are really motivates us to get them to feel better. Doing this as a number, here comes patient number 2154 isn't quite as fun as getting to know, the person and their families and all of that too.
Totally.
Mm-hmm. Yeah. Are you getting a lot of families too that come in and they'll bring everyone?
Yeah, it's kind of nice. We have a little referral system for families too, where if you bring in one, we'll discount, the new patient exam for another. But it's nice to kind of see who the guinea pig is sometimes too, whether it's the mom, the dad, or the kid, and then the other one comes with, and you just see them kind of looking from the corner the whole time, and okay, yeah, and then eventually maybe a couple weeks later, they pop on. You see a kid pop on too, and we're very right out of the gate we're the least salesy chiropractors we think that really ever exist. Sometimes we don't think we're even great business people in that regard, but we work in healthcare too. So it's this fine line you have to walk. But just again, being there for people is a really validating thing. So
it's kind of fun in school. So our treatment rooms in school are a little bit smaller. Our ones here are big. They're a 9x11 rectangle. It's crazy. But there was always this huge family that would come in. We were under the same staff doc. Huge family would come in there. I don't know, 4 or 5 kids would come in. And I think I took the mom, and then while I'm adjusting the mom, everyone else in our pod, because we usually had several of us students to one doc at the time, we were all playing like face paper basketball and keeping everyone entertained. And it was chaotic, but it was so much fun. The doors were open, everyone was having a blast. And we both really loved that environment. So we were like, okay, let's see if we can make sure that we can have that same fun, relaxing feeling. Because I think that also plays into the trust portion with our patients too. Because we do dress down, we do dress in athletics. We want an open communication. We want people to not feel like this is like a doctor's office per se with the sterility of it. We want people to have fun. I have magnet tiles in my rooms I had 16-year-olds playing with it the other day. Like, it's just like, come as you are. And then the more comfortable people are, the more they want to tell me about their day or what's going on in their life. It becomes a little bit of a quote unquote therapy session. Like, it just feeds into the good rapport with patients, essentially. So
yeah. That brings up a really great point. And I used to so I didn't grow up with chiropractic care, but I started to look into it. For me personally, I have scoliosis. After I had my second, so my oldest didn't get her first adjustment until she was probably maybe 4 or 5. But since then, my youngest has been getting adjusted since she was super little. So what do you tell the parents that they're like, I don't know if my kids would even like it, if they would even sit through it, and, will it be uncomfortable for them?
Totally.
Full transparency is I say it might not. And we're not going to force anything with kids or anything like that either. We're not, the research with chiropractic and pediatric care isn't so overwhelming that we think, oh yeah, kids have to be just getting adjusted constantly or anything like that in our office. Mm-hmm. But there's definitely anecdotal things that occur, like we've talked about, like getting sick with kids and just getting adjusted. And there's been things that show, hey, they report feeling better from this. So
kids are cool. They, there's a lot of other things with like kids that you can help with too. Constipation cases, sometimes earaches. Earaches are kind of hit or miss with some of that. But kids too, especially with babies, my youngest I've ever had in here is like 2 days old, and it really looks like I'm doing nothing. it's light hold pressure points. I usually tell people first common myth is there's cracking and popping with kids. In my practice, there is not until then we like after hands, then it goes to activator, and then we slowly transition. And most of the times too, like kids will come with their moms. And after about like the 5th time they've come with their mom, they're hopping up on my table like, my turn, hanging out and everything. And so it just kind
of... What is this about?
Right? They get real interested. They start playing with the cups. They pull on like different things. They start asking me questions. And again, it kind of goes back to that motivated piece. They start getting more comfortable. Then they start getting kind of motivated to get on the table, that kind of a thing. And so I very much so... kind of approach it in a very playful way. Half the time I'm using activator on kids while they're running around the room and I'm following them haphazardly trying to adjust them, or they're playing with the magnet tiles and I'm adjusting them through that. I really try to put it in the kids' hands too. I ask them like, hey, does this hurt? Is this an area that is not so great? And if they usually respond and they tell me straight up what they need done. So
can you share with the listeners what an activator is?
Yeah, so I don't know if I have one right with me, but it kind of looks like a pogo stick, and it's a low force technique thing. So it just creates a little impulse into a spinal area. I tend to use it a lot more so for muscle work personally, especially in adults too. I like it for muscle work, but it just puts a little bit of a proprioceptive input. So it kind of signals to the brain like, hey, let's calm this area down, or hey, we need a little bit more input into this. It's nothing groundbreaking, but it is enough that I have people that feel a huge difference from it. And I think it's a great way to control an impulse towards a kid too, so that we're not going too hard and we're not too gentle. It's got 4 settings, so I can really amp it up if I need to, or conversely, make it really nice and easy if I need to as well.
So when we're talking about women and bringing kids into the office, one of the things that we wanted to talk about today was pregnancy and how it can feel like a marathon for a woman's body. How do you approach supporting women throughout pregnancy and postpartum recovery?
Totally. So I totally is a marathon. You're training for 9 months, hopefully beforehand too, but if not, that's okay. It's something that I think strength training is really huge. I think making sure that women know that this isn't a disease or a moment that like we have to, again, provided your background's okay, that there's nothing bigger going on, that your OBGYN is cool with it. But I think empowering women to feel like that they can move still during this time, that they can actually push a PR if they want. And no, we're not going to start taking up running while we're pregnant all of a sudden, but doing the things that we're already doing and knowing that you don't necessarily have to stop it. I think it leads to better birth outcomes, and that's shown in studies. It leads to better like mental health too, because you are moving and whatnot. And so it's just something that can be really a powerful tool. Postpartum wise too, it helps in a moment when you feel like maybe you don't know your own body anymore. It helps you to kind of reconnect to it as well. So it is a marathon, and it's something that is really great during the entire perinatal experience that I try to really improve upon people as they kind of go through it.
And do you have a book of exercises that you normally use with women that are pregnant?
So I am BirthFit certified. It is a programming kind of certification that I did that is for a professional. It was made by a chiropractor. So it's in the wheelhouse of chiropractic, which is really nice. But it's everything from like, it pulls stuff from CrossFit, from another technique called dynamic neuromuscular stabilization. Talk about all those words being hard to say. And so it pulls a lot of things together that are very functional. And they can be, like, I could toss them to Zach and they'd be really functional for him too. So it's really something that, while it is tailored to to birthing people, it can be really useful for a plethora of people. But so yeah, I kind of pull from that, and I'll pull from other things that I've seen. Like, there's a lot of really great smart people on Instagram and social media, and I love pulling from them as well. So I don't really have to like recreate a cycle. There's a lot of information out there that I can kind of pull from as well.
Awesome. Cool. Okay. So next question. So you both are involved in the Erie community. Zach, when did you start coaching at golf at Erie High School?
I bothered Brandon Bird for probably probably a solid year and whatnot. I had begun teaching fitness classes for golf for some of the Erie High School kids at Fitness 1440, and eventually just got to a point where it seemed easier if I could just become an assistant coach and then get access to Erie High School and be able to do some of those conditioning programs up there. So I officially became a coach about a year ago for the girls season in the spring. And then I did the guys in the fall. And then all winter we were up at the weight room doing different things. And now we're starting my second season officially here. The girls had their first tournament just last week, and we'll get hot and heavy to it in April.
Awesome. How fun. How has it been?
It's been great. Last year just walked into kind of a dynasty. Erie had won 2 state championships in 4A the past 2 years, 2 individual champions as well. And then, so that year that I joined, they were at full force, and they took down 4A by, I want to say, close to 70 strokes, which Brandon Bird would quote me on that or let me know the actual ruling, but it's a state record. So super talented team, crazy athletic and crazy just talented on the golf course. So new year this year with just new girls coming in, and just, it's really exciting to be able to work with a new crop of kids and see where they're at, where their levels are at, and just, kind of see where their season progresses.
Mm-hmm. And what are some things that you're dealing with those particular athletes?
A lot of rotational athlete, like we talked about before in terms of my Titleist Performance Institute. The main goal of that is to take athletes through a movement screening process and see how well can you move in a golf swing. In some of these different positions that make sense, and that can be shown through the golf swing. How can we correlate this biomechanically to how you're swinging? So a really nice way to look at these athletes from a rotational perspective and kind of garner information from, okay, now let's put the pieces together, both in the weight room, in daily movement, hydration, sleep right, that whole picture model, as well as then on the course, good prep, good rehab, that even day of to get the body right as well. So both in office and at the course, a lot of different kind of situations that come up. It's fun to be a coach on the course, as well as then be able to coach through movement as a chiropractor in our office too.
Mm-hmm. Especially because I mean, I was an athlete growing up, and I feel like I didn't get quite the like holistic coaching that I probably should have. So the fact that you get to talk to the kids about, sleep and movement and nutrition and all of those things is really special too.
Yeah, absolutely. We were all just like taking like salt tablets and like just being told to, I don't
Gatorade.
know, do all that sort of stuff. So it's come a long way, sports science and nutrition. On the other end too, there's also a lot of information out there. So sometimes I think it gets a little overcomplicated and a little bit diluted. So sometimes just coming back to those basic things, super important, especially for young, resilient athletes to just get back to doing what they do.
Totally.
So did you play golf then when you were in high school?
I did not. That's my favorite part of this conversation is I did not play high school golf. So all my friends back home are like, you're a golf coach. But no, it kind of goes back to us when we first opened. We wanted to niche from a business perspective a little bit. So I was like, I've always looked at this Titleist Performance Institute as more than just screening golf athletes. It's allowed me to take a look at baseball players, a whole bunch of different, populations of people. So getting that opportunity to treat different athletes and kind of, looking at it from that perspective.
Everyone needs rotation.
Yeah.
I think that was a really cool thing to kind of go into as well. It helps. It's a really good, overarching thing. You can really use it for, I had him pick some stuff out for one of my patients that does yoga who's having a hard time with rotational stuff. So it's nice, again, to have someone that I can use things off of.
Right. Well, I'm even going through the things that I play. I was a swimmer, but even just getting that movement up and around to do freestyle, or I've also played tennis, getting that rotational movement in.
Totally.
Yeah, and it's not always just about rotation. I just did a TPI exam on someone yesterday, and we have you go up against a wall, and then we have you lift your arm up. We take a look at how your lats are moving. So a great example for a volleyball player who's going to be serving and playing overhead, that'd be one of the first exams that I would do to be able to see, okay, how well can you get your arm over your head? Okay, then let's also have you grab a seat here. Let's put this golf club behind your head and try and rotate. That's going to have a huge impact on your ability to get back and produce force throughout your swing as well for volleyball, baseball, you name it. It's really fun to be able to kind of just piece together different things. And I know I'm only scratching the surface with it, being a couple of years into it. It's going to be really fun as I continue to gain just more clinical experience and on the course experience, putting more things together.
Have you started to notice that either young athletes or older athletes have a lack of full rotation? Does it change, or does it kind of vary just depending on what their athletic ability is?
A little bit of both. That's a really good question, honestly, because, younger athletes are going to have more collagen. They're going to be a little bit more pliable, just move a little bit easier. But you can then look at, a high school athlete's swing and they could look like the stiffest person ever if they don't really know how to access some of those different areas too, versus, elite level golfers who can really get into their, lead leg and translate these different, biomechanical pieces together. So that's another fun aspect of carries. It depends. It's just meeting them where they're at with things. I'd say in general, right, you see a lack of basic thoracic spine mobility and then hip mobility as we age too, because we kind of just do what I'm doing now. Just we sit for good periods of time and we don't prioritize, moving in those given planes of motion. So sometimes it's really easy for some given average Joes to be like, hey, let's just get a little bit of hip mobility into your day to day. And they start to really feel that pretty quickly on the course too.
So let's say I was a parent, my kids are not playing golf at Erie High School, but I'm interested for them to be able to work with you. Are you doing this kinds of things just inside of your practice, kind of going through that as well?
Yeah, absolutely. It's, there's all these kids playing a whole bunch of different sports. There's a lot of money invested into these different things too. So you want to make sure that your body's moving and operating correctly. And so having a movement specialist in your corner, I think, is incredibly important. And that could be chiropractic, physical therapy, it could be obviously anything, but in the sake of, talking about us, having someone who does have some knowledge on your sport, just because I didn't play handball doesn't mean that I couldn't, put some pieces together in terms of, okay, but where do you feel most affected in your sport and moving from there? So whether we're viewing this from a TPI perspective or just hey, you're in my chiropractic office without any pain and you just want to improve as an athlete, perfect. Let's see how you move. Let's see kind of what you're capable of and then formulate your sport, what you need to do around it with rehab, again, with movement, and then just being a resource for you if you ever have any questions on anything. Or again, if something actually does happen from an injury perspective, to be able to look at it, get it treated as well.
Mm-hmm. Well, thanks for sharing all of that. Okay. So Dr. Brynn, you've been teaching stretch and mobility classes at Fit Club. How long have you been doing that?
I just started November 2024. So still pretty new at it, but it's been really fun.
Yeah. And have they given you free reign to create your own curriculum and everything?
Yeah, I create a new one every week. Some overlapping things, but definitely core aspects. I love cat-cow, so that's always there. Some of my favorite things in it because I do it with everybody. But it's fun. It's an hour long. It's Sundays at 10:15. We work out at 1440, which is really good time. And it's been a blast. It's really fun to see the class kind of ebb and flow. And a lot of times people, and I always tell them too, I'm like, tell me what you guys want. How are we feeling today? Do we need some hip work? Do we need to do that? And luckily, because I do give exercises in class, I can kind of on the cuff add some things in as we go. But no, I build a curriculum out. I build a playlist out every time because I enjoy music that says good, not chewy. So yeah, that's kind of fun.
Fun. I love that you're making it your own.
Yeah, totally.
How do you, and I want to hear from both of you, but how do you feel like that community connection has shaped your practice and your personal lives too?
It's easy to answer from a personal life perspective. I'm from Iowa and my wife's from Ohio. And so we moved out here not knowing anyone. It was a really cool, exciting aspect of it, but also absolutely terrifying in terms of opening a business where trust is involved and just a lot of different things are really important. So right out of the gate, we just wanted to be grassroots with everything and just try and meet people. And then of course, 5 months into moving here, the pandemic happened. So just a lot of different like small obstacles that we were having fun kind of, and maybe not fun all the time, working around and over a little bit. But the community feel to me like these are our friends. Like these are our, not only some of them being patients, but our friends in our community. Like we were just helping a local farm here that we're going to be doing some gardening in, help clear out some of their garden beds a little bit. And there's some of our closest friends that we have here. It's just community is so important in today's world, right? To get into that a little bit, like we all crave it. We crave connection. So to be able to have people in a place that we've never lived before, that we know, trust, and love is super important to us.
Yeah, I think investing in it's a big deal too. We want your community to be as good as you want it to be. So kind of putting your money where your mouth is, like being down here, supporting people. I'm on the chamber board. I'm vice president and secretary, and I really love getting to know other new small businesses in town and going and showing up at their ribbon cuttings. And we've been there too. We remember our ribbon cutting, and remember when you know no one and you have those people that you remember that came and stuck it out and saw you. And hi, Ruby, welcome back. And I think it's so beneficial to have a community in your corner when you're a small business, and we really feel that here.
Yeah, it's absolutely awesome here. Just the connections that you feel like you make, and the people that you can lean on. Especially not, again, I talk more personal, but even the business side of it too. Understanding, hey, who do you use for an accountant? Like, who do you use for this? And to even talk about this podcast, right? Like when you released that first episode, I had the chance to then talk with Dr. Bo. We've met up for coffee, and now I know a local physical therapist in the area that if I feel like I'm not being able to get results with something from, here's someone else that I can refer to. So not only does it help us clinically, it helps our business, it helps our patients. So like just, we have to be community forward almost with our business. It's super important to us, and we really want to be, and we really have a lot of fun with it too. So
I was talking with Christine at Bridge Refill Market, and I just feel like we have a lot of community and like town pride, and everyone wants to help each other and, just promote each other, which is really great and exciting too.
It is. It's really sweet.
Christine
awesome.
And Bridge is awesome. They are such an awesome addition to Erie as well.
Yeah.
Just a shout out to
So what is one piece of advice you would give to someone looking to take a more holistic approach to their health?
Good question. I'm going to touch on something I kind of talked about before, just in terms of simplicity. I think that today's world, there's so many things, right? Especially on the like recovery side of health and wellness, and like, what should you be doing? And then you have the commercial side of things too, where everyone's on Instagram and social media and you're being sold, hey, you need to be doing this. And then I love the memes where it's like, you shouldn't drink bottled water, and then you spit out the bottled water. Then you go get tap water. Oh, don't have tap water. It's like, you're always told no and what you shouldn't do, kind of in this sort of space. So to be able to just simplify it. Yeah, sorry. Just keeping it simple. Like a lot of the things we've been talking about are things we're talking about with patients every single day. Hey, where are your hydration levels at? Stress is such an overlooked aspect of musculoskeletal care that we are always really emphasizing, just that aspect of it as well. So I would say keep it simple. Not like I'm making this answer, but whatever works for you, do your research and do it diligently, but also, lean on other people's experiences and just make decisions that make the most sense to you. And
sleep, keep your stress low. Easier said than done for sure.
Yeah.
Drink some water, throw some electrolytes in there, get those, it's like the Maslow's hierarchy, get those basic things. And then you can, if you want to make it complicated, then you can. But a lot of times we find, and research kind of finds, as long as those basic needs are met truly, life's a little bit easier to adopt to. adapt to. How about that?
Yeah. And when I say simplicity, by no means do I mean that doing those things is simple, like getting your hydration levels consistent and eating consistent, good nutrition and things like that. Simplicity in terms of just focus on a couple things, just focus on like one or two things that you can really feel like you can, manage and maintain that are within your control. And then what does that do for you? Then we build off of that. And then maybe we sub in something else and just kind of, keep it simple. It's going to maybe be a little bit boring, but if you're consistent with it, you'll see results over, a given amount of time.
Mm-hmm. Absolutely. One thing that we did not talk about that I wanted to make sure that we brought up was you incorporate dry needling into your practice.
Yes.
What are some of the common benefits you see with that?
Let's kind of even tie it around the biopsychosocial model a little bit. We've been talking, so it's not just the physical component, but just the physical side of things, really looking at, stimulating blood flow to tissue that maybe isn't moving or feels tight to the patient, that we just feel like, hey, this is something that could use stimulus. So we offer some of the dry needling work, similar to acupuncture, just placing small needles into given aspects of the body. We're really focusing on decreasing some of those trigger points. Mm-hmm. But then also like just the feel, right? So a lot of patients will get up after we dry needle them and just get that immediate relief. It's unlike some other things sometimes that we offer in our office. Dry needling can really produce an immediate relief symptom. So then there's less fear around movement. The patient feels empowered to then maybe do some of those movements that just before didn't feel as awesome. So there's that immediate impact to it as well, socially or psychologically. And then, just the decreasing the symptoms of that area is kind of what it's all about, making sure that it's not so neurally stimulated and just decreasing symptoms overall.
Okay, thank you. I wanted to make sure we talked about that for sure at some point during our conversation.
Yeah, nailed it.
Okay, what is one big goal or vision you have for your practice in the coming year?
Ooh.
I feel like this is the one I looked at the least or thought about the least, and it's probably a really good question too. It is a good question.
It is. I think we keep growing. We're kind of in we've hit we're going to be 5 in August. Mm-hmm. So obviously the big goal is we make it to 10. That'd be really cool. But I think really growing, I think we do a really good job in the community. I want to make sure that still goes and that our community as a whole is growing. I'd love to see like our niches really take off too. And just kind of keep doing what we're doing. I love what we've built and I feel like we have it. And mm-hmm. then I just want to see it really blossom and keep scaling.
It's kind of, again, what we said before, consistency, just being boring in that kind of regard too. And just, making sure that we're showing up for our patients every day, showing up for the different hats that we wear, golf coaching, chamber member, stretch coaching, all that sort of stuff too. Mm-hmm. And just being consistent with some of those different things.
And I think staying open to opportunity as well.
Mm-hmm.
Mm-hmm.
Being able to pivot, all that kind of goes. There's, again, so many opportunity and this place is growing. Erie is growing so quickly. I think just being open-minded and being ready for it.
And then lastly too, just leaning into the people that kind of have gotten us here, right? Like we've established some, really strong relationships and roots with different people here and, making sure that those voices are championed and that we just, the people that have really formulated our Erie family just are really important to us. So leaning into those people, those businesses, those different ideas and allowing the rest to just, again, go from there.
Well, I feel like you guys are doing a really good job about getting involved as many things as you can, obviously. There's only so many hours in a day, but it seems like what you're doing with your time, you're being intentional about what you're doing and saying yes to. So
definitely.
Absolutely.
Okay, well, thanks for joining me on the Erie Wellness Podcast today. Dr. Brynn and Dr. Zach shared incredible insights on supporting families and athletes through their expert chiropractic care. Be sure to check out the show notes for more info and stay tuned for more inspiring conversations. That's a wrap for today's episode. Thank you so much for listening to the Erie Wellness Podcast. I truly appreciate you being a part of this journey. If you loved today's conversation, don't forget to subscribe, leave a review, and share it with a friend. For more daily wellness inspiration and behind-the-scenes content, be sure to follow me on Instagram at the Erie Wellness Podcast. I can't wait to connect with you again soon.